BDS and MDS students, let's do a rapid fire revision on growth spurts. First rule of growth. Human growth is velocity, meaning it happens in transient, non-linear, rapid waves of skeletal development rather than a steady, predictable climb. You must classify these into exactly three distinct periods. Let's break them down by clinical significance. So period number 1 is the infantile or postnatal spurt. This spans from birth to roughly 3 years of age. Your key takeaway here is a massive neurocranial growth and severe volumetric expansion of both jaws to accommodate the developing primary dentition. Period number 2 is the juvenile or prepubertal spurts. These hits around 6 to 7 years of age in girls and 7 to 9 years of age in boys. This is your interceptive phase because the mid-palatal suture and surrounding soft joints are still loose. This is the absolute peak time for the maxillary expansion to correct the skeletal crossbite. Period number 3 is the pubertal or adolescent spurt. Girls hit these at the age of 10 to 12 years and boys at the age of 12 to 14 years. This is your golden window for mandibular modification. If you have a skeletal class 2 patient with a retrognathic mandible, functional appliances like twin blocks or hubs are highly velocity dependent and must be timed precisely with this pick. But you cannot rely on chronological age to time your appliances. You need biological indicator. On a routine lateral cephalogram, we look at the CVM, cervical vertebral maturation, by analyzing the second, third and fourth cervical vertebra. Memorize these landmarks instantly by looking at the inferior border of the C2, C3 and C4 for notches and the overall shape of the C3 and C4. Stage 1 is called CS1, means no notches, completely flat inferior border. C2 and C3 are wedge shape. You are 2 years before the peak. Then CS2, a notch from on CS2 only. The bodies are horizontal rectangles. You are 1 year before the peak. CS3, notches are clearly present on C2 and C3. The bodies remain horizontal rectangles. The peak starts now. This is your green light to deliver functional appliances. CS4, notches are present on C2, C3 and C4. The peak is ending. CS5, all notches are present but the shape transition to square. The spurt is finished. CS6, the bodies become vertical rectangle and skeletal growth is completely done. Now what is the alternative indicator? We turn to hand raised radiography via the Jork and Fishman methods. Thank you.